Vice President Biden's campaign calls your plan, quote, a have it every which way approach, and says it's just part of a confusing pattern of equivocating about your health care stance. What do you say to that?
Well, they're probably confused because they've not read it. But the reality is that I have been spending time in this campaign listening to American families, listening to experts, listening to healthcare providers. And what I came away with is a very clear understanding that I needed to create a plan that was responsive to the needs of the American people.
Senators had several plans so far. And anytime someone tells you you're going to get something good in 10 years, you should wonder why it takes 10 years. If you notice, there's no talk about the fact that the plan in 10 years will cost $3 trillion. You will lose your employer-based insurance. And in fact, you know, this is the single most important issue facing the public. And to be very blunt and to be very straightforward, you can't beat President Trump with double talk on this plan.
Your response, Senator Harris?
Absolutely. Unfortunately, Vice President Biden, you're just simply inaccurate in what you're describing. The reality is that our plan will bring health care to all Americans under a Medicare for All system. Our plan will allow people to start signing up on the first day. Babies will be born into our plan, and right now 4 million babies almost are born every day in America, or every year in America. Under our plan, we will ensure that everyone has access to health care. Your plan, by contrast, leaves out almost 10 million Americans.
The plan, no matter how you cut it, costs $3 trillion when it is in fact employed. Number one, 10 years from now, after 2 terms of the senator being president, after her time. Secondly, it will require middle-class taxes to go up, not down. Thirdly, it will eliminate employer-based insurance. And fourthly, what happens in the meantime?
The cost of doing nothing is far too expensive. Second, we are now paying $3 trillion a year for health care in America. Over the next 10 years, it's probably going to be $6 trillion. We must act. Your plan does not cover everyone in America. By your staff's and your own definition, 10 million people, as many as 10 million people, will not have access to health care. And in 2019 in America, for a Democrat to be running for president with a plan that does not cover everyone, I think is without excuse.